Hi guys, Dr. Daniel again. Today we got a oral hematoma on a 11-year-old golden retriever. Came in today, the owner thought it was an abscess on the ear, but it's definitely full of blood. We've just prepped it with some iodine that's been diluted, some cotton wool in the ear. You can see completely full of blood. The owner said it's got bigger in the last few hours, so if you don't do corrective surgery, it's probably going to take up the whole of the ear. So it's been clipped and cleaned. We're going to use a non-absorbable suture material for the sutures, and we're going to do an S-shaped incision along the whole of the ear. Just got to mind where the blood vessels are. Very standard, straightforward surgery. If you just turn the ISO up to 3, please. You just turn the ISO up to 3. Just going to turn the ISO up a little bit. Lovely. In terms of post-op care, we normally keep the sutures in for around 2 weeks, bust the collar for 2 weeks, NSAIDs for around 7 days, and I like to do broad spectrum for 2 weeks as well, just because it's a very dirty area and there's a high risk of infection. Let's see if we're a little bit better. So you want to go all the way through the ear, just like so, all comes out with blood. Now the thing is, if you were to just make a hole and leave it, it's going to fill up with blood once there's a clot there, and it's just going to come back the same day or the day after. You just turn the ISO up a little bit more, please. Let's say if you just put it on 3.5. We did blood panel just before sedating the patient, which was all absolutely fine. Just like that. It's very messy surgery, there's a lot of inflammation. And usually once I've made my incision with the scalpel blade, just like that, make sure I'm all the way through. Just want to go into the cartilage. Just like that, you can see the inside of the ear. You see that? And basically you're going to get all the clots and things coming out. Don't mind the bleeding. Just want to make sure that there's no major blood vessels there, which are not. We've avoided those. And now we want to do our suturing. You don't go all the way through, you just go through the first layer, just into the cartilage, just like that. Bit of a messy surgery. I usually use a sterile pin. And then the rest of the surgery is just doing sutures either side. I tend to want the head of the suture, so the knot, on the outside of the ear. So you want to go either side of the incision like that, so either side there, avoiding any major blood vessels. As you go through like that, you're going to hold one side of the suture, bring the other side through, grab the other end. You can use Vicryl or PTS. I tend to find a non-absorbable, less reaction, and it's much more secure. And then I tend to do a surgeon's knot or a modified miller's knot on the outside. Some vets use a button or some plastic or something, but if you just don't do them too tight, you'll be absolutely fine. It's less irritation for the skin, a little bit quicker of an operation. Less risk of infection as well, because otherwise you have to ideally sterilize the buttons and things if you're doing all of that in an ideal world. And where I made the incision on the other side, you're going to leave it open. It's going to drain a little bit, so make sure the patient's stuck to one room in the house if the owners are worried about bleeding. I normally do maybe 8 or 9 throws, just so it's easy when the patient comes back to have them removed. And I keep the heads quite long. It makes our life much easier when removing the sutures, because we don't really want to sedate when they come in 2 weeks' time to remove it. If you do them too short, you're going to have a difficult time, especially if the patient is very wiggly. So you kind of want to jagger the sutures, so you don't want them all in the same line. Because if you hit the same blood vessels throughout, those will die. You don't want that. Just like that. Grab the other end. Put it all the way through. And then you can go a little bit higher up. It's a very effective old school method. I've never had any issues with this myself. You just have to sometimes warn the owners if it's a competing dog. There's a risk that maybe the muscle in the ear doesn't hold the ear up like it used to. And sometimes the cartilage prevents them having those nice pointy ears, and it might be a little bit more floppy. But in the end of the day, if you don't do the surgery, chances of this getting fixed is almost 0 to none. I have tried draining them, but they just come back. I've tried head bandages, and again, doesn't seem to make a massive difference. So I normally just give them the options, tell them if they want this to be fixed. Surgery is the best advice. It's not a particularly painful operation, even though it looks quite big. Metacam will be enough by itself. If they are a bit of a stressful patient, don't like being isolated in a room at home because the owners don't want to get blood everywhere, I do include gabapentin as well, just to help with that little bit of anxiety, and it's a really good safe pain relief as well. So you can't go wrong adding that. This old girl will be fine with Metacam. In terms of the dosages for the broad spectrum, I usually do about 12.5 mg per kg, and that should cover you completely. I tend to do a longer course because it's such a dirty area, and I have seen a couple from other vets come to me and have been infected, and it's because they've not had antibiotics, or the course of antibiotics hasn't been particularly long. So in those cases, just do a 10 days course and you should be fine. Recheck usually between 2 and 5 days, just to make sure everything's looking okay. But yeah, it's not a particularly difficult surgery, and it's very rewarding when it works and they come back with no problems. You really don't want to do the sutures too tight, because you can imagine there's a lot of swelling at the moment. Once the patient wakes up and the blood pressure increases, swelling's probably going to get a little bit worse, even with the NSAIDs. But yeah, I usually see this in either cases of acute trauma like a dog fight, or chronic scratching, and it's just got worse and worse, and then the patient's created a pocket in the ear from scratching for so long. And that's what's tends to happen in this girl, because the owner said that they didn't see anything happen, and the dog does have a history of allergies, so we've got to make sure we're on allergy medication, because we don't want it to tap into the other ear. See, it's not bleeding as much already. So you've got suture here and here. So some people would want to do one here. I'm going to go just on the lateral aspect here, minding any major vessels if we can avoid them. Sometimes a bit fidgety when you get a lot of sutures in the ear. If you leave any space that's too large, you will get partial hematoma form again, and you're going to have to go back into surgery. So my advice is to take your time. If you need to place more than enough, then fine. I'd rather you place a few too many than not enough and have to sedate and go through this whole surgery again. Try not to get any of the other sutures stuck inside the ones you're placing. Let's give that a wipe and have a look. The surgery is pretty straightforward. I'm going to go all the way across. Oof. It's a little bit hard when your hands get a bit slippy. And this is much less common in cats. I've only had one case in a cat, just because they don't have the same anatomy in terms of the amount of space inside the ear. You're more likely to get an abscess in the face than anything else in a cat. So once this starts getting a little bit blunt, I tend to use one of the swabs to help push it through. Probably easier with one that hasn't got much blood on it. Just like that. And you're going to pull the other side. Once you've placed the suture in the ear, try to avoid pulling it through the other side, because you will introduce the harbour bacteria into the surgical site. It's easier said than done. You've got to do what you can do in these cases. Some vets do a head bandage after this. You shouldn't need to do any head bandages. I find it's incredibly uncomfortable. And I've even had some patients where the bandages got too tight and had to go to out of hours to have it loosened. So would probably avoid at all costs a head bandage if you can, especially with owners that are very panicky or are likely to not have the best compliance. Side, push all the way through, grab one end, pull that through, get the other end, it's a little bit hard, and we're going to go above, go through. Grab the other side, like that. And you just use gentle pressure, you don't want to pull too much. And yeah, it's a pretty good surgery. You'll see a few of these every year, depending on the area you're in. If you're in near a very busy park, you're likely to get a lot of hematomas from dog bites. And it's also another thing to talk about with owners where the patient's got really bad allergies and they don't really want to go down the route of treating it. It's a possibility in can cause the owner a lot more money in the future if they don't get it under control. This one was a little bit more unusual because the patient is quite old, and to get a hematoma from allergies in an old dog, you don't really see that common. So now we're going to go below this one, go down there, all the way through. Pull that through whilst with my other hand holding one side. Grab the side that hasn't come through yet. The chances of this coming back in the same ear is very, very low, because if you've done this correctly, you'll have a lot of cartilage in the area. But it is possible if there's, again, not a good client compliance and they let the patient scratch at the ear. It needs time to heal, which is why I normally say 2 weeks. Post-op check, 2 to 5 days, maybe a week after that, and then the next recheck, 14 days post-op for the sutures to come out. We should have hopefully a very happy dog with the cones come off. But yeah, if you ever have a dog booked in for a lump on the ear or an abscess on the ear, chances are you're going to have an aural hematoma. This one was initially booked in for an abscess on the ear. The owner was a little bit shocked to hear that it wasn't just going to be antibiotics, it was going to need surgery. If the owner just wants pain relief and antibiotics and not to correct the ear, chances are it's just going to form a hard clot and probably cause chronic pain, and is unlikely to resolve in the future by itself. So they just need to be aware. And if it continues to spread the hematoma and affect the whole ear, you could cause risks of infection, and if it gets very severe, then aural hematoma can turn into an ablation surgery, which is pretty catastrophic if we have to go down that route, which has a lot of risks, which is removal of the ear canal. But I haven't had a case like that yet. Everything's going well. Just going to keep placing either side of where the incision is, these sutures. We're going to do it until there's no more space left. Take our time, don't rush these. Doesn't matter how long it takes, as long as you get it done properly. You really don't want to be going back and doing this again, especially in an older dog. As long as you can keep your surgery time usually under an hour, that's perfect. Because every minute over an hour, the risk of infection doubles. So we don't want to be going into that time at the minute. Starting to look really good. Okay. So you can see there's a tiny pocket under there. There's a tiny pocket under here, so we need to make sure that's closed. So it's going to be very small. If we don't sort out any small pockets, the blood will rush there immediately. Yeah, it's a bit of a messy surgery during. Once we've cleaned this ear up nicely, it'll look absolutely fine. And we'll probably clean up the ear with some dilute Hibby. You can always give the owner some Hibby to take home to clean the surgical site as well. You will likely get some crusts form in the area of these sutures. But after the first day, there shouldn't really be any bleeding from the incision site. And we're going to have a dog with some cauliflower ear. Now we're going to go and just check how things are looking. So we've got stitches here. So it's like there's a blood vessel that side, big blood vessel here. So we've just got to be careful of that. So I'm going to go just below it here. You can tell when you've hit a blood vessel because as soon as you've done it, blood will seep through the top of the suture. And you can still place it as long as it's not one of the major vessels. And if you're concerned, just take it out, a clot will form and it'll stop bleeding. And just go slightly lateral to that. Sometimes very hard to see where the vessels are, especially if the dog's got very dark skin as well, but that's not the case with this one. So we're nearly done, we're just going to keep placing these sutures. And even if the hematoma is only a small, or just the top of the ear, let's say, or the base of the ear, I still usually make a S incision all the way across the ear because it can just spread there anyway whilst the dog is flapping his head at home, and this will prevent that happening. So I kind of tackle each one the same. The incision should always be across the center of the hematoma, but I usually do the corrective surgery for the majority of the ear in the location of the hematoma. Because you're going to look a little bit silly if you send it home, you sort out one, and then the top of the ear or bottom of the ear then comes back with a hematoma, and you've got to do the same thing all again. Just with blunt force bringing this through. Looks quite traumatic, but it's very effective. I always place a puppy pad on the floor just in case when you made that incision, blood goes everywhere. Sometimes there's a lot of blood pressure behind it. This one wasn't too bad. And this is a non-absorbable suture, but you can use Vicryl or PDS because they're all going to hold most of their strength for the first 2 weeks. I just find this one's quite thick, it's easy to place, and I can put it on the reel. There's no need to have an absorbable suture material for something that's going to need to come out in 2 weeks. It depends on what you prefer. So I need to place some more on this side. Push all the way through. One side as you pull through. And this is a very routine surgery. New grads can do this, no problem. Just get shown how to do it the first time. You'll be absolutely fine afterwards. It's not that scary. Don't come through. Basically giving the dog some earrings. It's a nice surgery to do, not particularly complex, doesn't tend to take too long to do either, and it's very rewarding. Remember, if you're going to be removing these, it's going to be quite a lot to remove. So give the nurses a heads up to take the day off when it comes in. So if lots there, you're looking for any pockets like here. You see there's no sutures here, so there's a chance that can fill up. So we're going to go just lateral to that suture. That. I'm going to go, so you've got a suture here and here, so you can go here, you can go a little bit lower down, so I'm actually going to go lower down, so that I'm below the incision slightly. Going to make sure we're following the whole of the incision. So if you make it very long, you're going to be placing a lot of sutures. The other thing, if you do buttons and things and you run out, you're still going to go back to doing this anyway. In terms of plastic, I've seen people use like parts of the IV fluid setups. Again, I just find it a little bit unnecessary in most circumstances. It's just more things to remove. It's not particularly sterile in most of the cases by the time you put it on. It's just more weight on the ear, more irritation to the skin. I think most vets do that just so that they know they're not doing it too tight, the sutures. But it can look nice for the owners. It's looking very good. You all good?
Heart rate is 104 and respiratory rate is 12.
can try turning down the ISO by half, please. We've been very stable. And with the general static, it's always a balance of trying to find not too deep, not too light. In an older dog, it sometimes varies a lot. It's just a balancing act most of the time. But for this little one, we used a half a dose of acetaminophen, boop, and propofol to effect. I find that works really well. If there was a sort of respiratory problem, like a brachycephalic dog, we'd probably switch to propofol to effects alone and not use the ACP. I usually trust my nurses, what they want to use for the patient. Nearly there. Make sure there's nothing here that can blow up. So we're going to go a little bit wider now, just so that we don't get this issue happen again. Start forgetting where you placed your suture and which one's been done already. But overall, this dog's not really had any health issues. It's been a very healthy girl. My blood panels, I always check any dog over the age of 6. T4, and we have diagnosed, especially at this clinic, a hell of a lot of dogs that have had maybe undiagnosed T4 for multiple years because we started including it in all our routine blood checks now. Unfortunately, hypothyroidism is a very undiagnosed issue, and we've been picking up a lot on that. But this little girl's T4 was perfect. So at this stage, we're making sure there's no areas which can become an issue for this dog. Probably going to place another one down here, just because it's a spot that I do tend to see the hematoma pass to. So there to there. We're going to do a suture just under there. Do we have stuff to clean the ear? We're nearly done. Thank you. If you can keep the surgery to about half an hour, 45 minutes, done good. Obviously a bigger ear is going to need more. either side of this. This is looking fine. There's a little bit of blood in that area. So I'm going to place one more. A little bit close up. Just because I can see a blood clot there. I don't want to see that blood clot move and then some blood start seeping under the skin. So I'm just going to place it in here. I think that'd be a good one. Okay. Not a happy cat in the background. But do let me know if you prefer the audio videos or not. Some people might find it helpful. Because I do have another video of a oral hematoma being done with no audio. It's just got some music in the background. Like that. These are looking really good. So many ends and tips of the sutures. Right, let's see what this is looking like. So we can see here, we've got the inside of the cartilage. So what I tend to do is I tap the side. Can't feel any pocket down there. I might do one more suture here, just to protect this side. We've got plenty on this side here. I may do one just on the pinner, in case that causes a bit of swelling. I think we'll be looking good after that. So overall, I'm quite happy with this one. Breathing gone up slightly since we reduced the ISO, which is good. Happy with that. Just having a look, so I'm going to place one more just on the pinner, just so that we don't get anything form underneath. Just like that. Just being extra cautious here. Sometimes a bit tricky to try to not stab yourself doing this. So hopefully I'll see this girl in a few days' time. The ears will be looking much less inflamed. You can, if there is a really bad infection in the ear, apply some sort of antibiotic into the ear. I do that sometimes. I place Ozonia or Neptra. which normally lasts 7 days for the Orsernia. Neptra lasts usually around 14 days, the NOAA compendium states. And that will clear up any infection, which could also be why the dog was scratching the ear to begin with. We had a look at this dog's ear and it doesn't look like there's any infection, so that's fine. Just because sending them home with ear drops is sometimes a little bit difficult when the patient has already had surgery on this ear. Place one, just so that's looking okay actually. The pinner's done. That should cartilise. That should be fine. These are okay. These are okay. Just going to make sure. So you've got a major blood vessel here, so you can't really place one any lower there. That's fine. You want to make sure there's no spaces underneath. Can't feel anything there. Feeling the other side. This is the side that was worstly affected. So we're going to place one more here. It's a bit of an awkward spot. Here, and we're just going to go just below it, just because this is where the main part of the hematoma was. So there is a higher risk of that area being an issue, even though it's close to the edge of the ear. We are limited in space when we're close to the side of the ear. And there's a tiny bit of bleeding, which means we're on top of or next to a vessel, which is fine. Because if we didn't do this here, there's a risk this would have been another hematoma in this area. The bleeding itself will stop. Now we've placed it. See where the pocket was initially. So that feels good. Can't feel anything there. Right, one more and then we're done. Place the last one in between these two, slightly lower down. It's a little bit tougher to place it further down the ear. So this will be the last one. Then we'll clean up the ear, wake us up. And we've got the patient on 3 times maintenance during the surgery. We'll bring that down to 2 during recovery, and then slowly put it back to normal maintenance Once we've woken up, we've had some food, we're eating and drinking. I always routinely in these surgeries give a penicillin injection on the day of the surgery, and the Metacam injection, so the NSAID Metacam as well. And get the owners to start the antibiotics and pain relief tomorrow morning on top of the food. That's quite simplistically how to do an aural hematoma in a large dog. I'm going to clean this up, see the dog again in 3 to 5 days. It should be finished. Thank you.